This week is Cervical Cancer Prevention Week, a national international campaign highlighting how cervical cancer can be prevented through HPV vaccination, regular screening and early awareness of symptoms. In Ireland, unfortunately, around 250 women are diagnosed with cervical cancer each year, despite the fact that most cases are linked to HPV and are largely preventable. We're joined now by Dr. Nóirín Russell, Clinical Director of CervicalCheck. Nóirín, thank you so much for joining us on this.
Good morning. Delighted to chat about this wonderful topic.
And a very important topic indeed. And just why is this week so important in terms of public awareness and also prevention?
So this week is really important. Cervical Cancer Prevention Week it allows us across the globe to really focus on the key things that people can do to prevent cervical cancer. So it's really positive news that cervical cancer is a preventable cancer. And there are three main things that we're reaching out to people today and recommending for this week. So the three main parts of cervical cancer prevention are HPV vaccination, and this is offered to boys and girls in first year of secondary school. This is really important. It reduces the risk of developing cervical cancer later in life, and it's a one-off vaccine offered to boys and girls. It also reduces genital warts and other HPV-associated cancers. So that's really important. And this last week, we've had an announcement as an extension of the Laura Brennan HPV vaccination catch-up programme. So that's available to fifth and sixth year students in secondary school who missed their opportunity in first year. And that's really important and wonderful to see. The second part of prevention is HPV screening. So this is HPV cervical screening. It's offered every 3 or 5 years, depending on a woman's age. And this is really important because it helps us to identify abnormalities before they can get anywhere close to cancer. We can identify them, pick them up, and treat them in colposcopy clinics around the country, which are outpatient clinics. And that's where these abnormalities can be treated before the cancer even gets a chance to get going. So vaccination with HPV, HPV screening, and treatment, they're the three things that we know will reduce the risk of cervical cancer. And we're asking everyone this week, support women, girls, your friend, your sister, your mom, and recommend everybody to take vaccination if they're eligible or to get screened if they're eligible.
Okay, so you've taken us quite well through the prevention, Nóirín, but what about the symptoms? What symptoms should prompt someone to contact their GP? And that's even if they are up to date with screening.
So the most important symptoms for anyone listening this morning is abnormal vaginal bleeding. So if a woman is experiencing vaginal bleeding in between periods or after intercourse or after the menopause, that's a really important symptom, and that means she should make an appointment with her doctor to discuss this symptom. And sometimes women are unsure if it's bleeding or discharge. So I would say any unusual blood-stained vaginal discharge or vaginal bleeding in between periods, after sex or after the menopause, that's the main symptom that I really recommend that women would be aware of and go to their GP to discuss.
Nóirín, does having HPV just automatically mean someone will develop a cervical cancer?
Not at all. So HPV is actually a really, really common virus. And most of us will be exposed to HPV at some time in our life. And for the majority of us, we'll get a HPV infection and clear it. And we know that 80 to 90% plus of people will pick up HPV at some time. What's really important is that for a small number of women, the HPV stays in their system and stays in their cells of their cervix, and that's what can drive the abnormalities, and that's what screening can pick up. So we look for HPV first, and then if we find HPV, we look at the cells, and it's the combination of the HPV infection staying present for a long number of years and abnormal cells that then gets women are then referred on to the next step to go for a colposcopy to get a further evaluation to look at the cells. And for the most women who have HPV detected and who get referred to colposcopy, they will need nothing further. They can get reassurance, and the vast majority of people won't get cervical cancer. But it's just we do a broad sweep of the population to find out who could benefit from that extra examination, and that's what the screening program, it provides the free screening, and also colposcopy is free. So all of these steps, vaccination, screening and treatment, are free. And it's really important that, that we normalize chatting about HPV infection. It's really common. 11% of the population will screen HPV positive every year. So nearly over 1 in 10. It's really common. Nothing to worry about. Just do the follow-on bit that's recommended.
And just on what you just said there, because our target is, of course, here in Ireland, 90% HPV vaccination uptake, but we're not quite there yet. In terms of what's holding us back, are there a number of elements, one of which is what you just said there? Is there not enough, as of yet, normalisation of speaking about it? It's not a kind of regular topic of conversation amongst people?
I think our vaccination rates are really impressive on a kind of a European scale and on a world scale. But I think as you said, we really want to improve them. And I think one of the things that's so important is to address that stigma about talking about HPV infection and normalising it and explaining this is really common. All of us will get HPV infection. And what screening is doing is it's just trying to work out who still has HPV infection. And then the vaccination piece is about saying to parents of young girls and boys who may be nervous about HPV vaccine, who may be worried, say, this is a safe vaccine. This is really recommended for your boys and girls. It will reduce their risk of any HPV-associated cancers down the line. It's really well researched. There's really good science behind it. We have Irish data to show that actually our girls who turned 25 and started getting screened for the first time, those who were vaccinated have a 60% lesser chance of having abnormal cells. So I think talking about that, the real hardcore evidence about the benefit of HPV vaccine and reassuring parents that it's safe, I think that will get us to that magic threshold of above 90%.
We have, of course, committed to eliminating cervical cancer within 14 years by 2040. As of now in 2026, Nóirín, how realistic is that goal?
The amazing thing about this is really achievable. So Ireland has got really high uptake of vaccines, really high uptake of screening, and really high uptake of treatment. Now that doesn't allow for complacency. We need to keep that uptake high, and we need to get higher. We need to get that vaccination above 90. We need to get screening up to 80. We're there with the treatment. We're above 90, but we should, again, no room for complacency. And I think that goal is really within our grasp. We can see it, we can see the data, and it's such an exciting time to work in cervical cancer prevention because we can see the benefits of vaccination and screening, and we can see that we are on track to reach that elimination threshold, which is making it rare, less than 4 per 100,000 by 2040. And sometimes I think we might even get there before that. We are doing really well, and it's about, I think our focus now is about understanding who doesn't get vaccinated, and who doesn't get screened, and really helping and targeting, education material and working with people in communities to try and understand what do we need to do, what does the system need to do to help them to address their concerns and to help them overcome any barriers to screening and vaccination. And that's part of just this elimination. We want elimination. We want this terrible cancer to be rare in all communities, in all areas, for every woman.
Okay, we do have to leave it there, but Nóirín, thanks so much for your time this morning. That's Nóirín Russell, Clinical Director of CervicalCheck.